Hello and welcome to Quick Bites, where we talk about firefighter nutrition in 10 minutes or less. My name is Megan Lautz, and I'm a registered dietitian that specializes in first responders. And today we're talking about firefighter cancer and more specifically, how to prevent it through good nutrition. Now, unfortunately, firefighting as an occupation has been classified by IARC as a type 1 carcinogen, which means it is known to cause cancer in humans. And we see a 9% higher risk for firefighters developing cancer and a 14% higher risk of dying from cancer relative to the general public. And there are several reasons for this, mostly due to the exposures to several different types of carcinogens, including shift work as a first responder. One, it could be through inhalation from not wearing SCBA for certain calls, or the SCBA doesn't fit correctly. Absorption of contaminants through the skin, specifically around the gear, and ingestion. So not washing hands, not washing contaminated gear, and then ingesting it either through the mouth. Now, of course, the main thing for first responders or firefighters is decon. Decon is going to be essential after fires and following those protocols as best you can and updating them as frequently as possible. When it comes to food, however, the big thing here is that the dose makes the poison. So you're going to probably see a ton of different headlines that will say X product is now considered a carcinogen. Specifically, aspartame has recently come out as carcinogenic in the headlines. And that doesn't always mean that that is true for that specific product. So we actually kind of have to look into this a little bit further, because if you have a Diet Coke every now and again when you go out to eat, is that going to cause cancer? Probably not. And what we go by is IARC's hazard classifications. And there's a handful of foods that are on these lists. Most of these are things like benzene and other chemicals. And you can, of course, see these on IARC's website. And type 1, there are 4 classifications for that IARC has for products, right, or chemicals. We have type 1, which means it's carcinogenic for humans. 2A means it's possibly carcinogenic to humans. There's limited evidence in humans, but there's sufficient evidence in animals. There's 2B, which means it's possibly carcinogenic to humans, but there's limited evidence in both humans and less than sufficient evidence in animals. And then 3 is non-classifiable to humans. So the particular concerns from a food perspective is the type 1 carcinogens are alcohol, processed meat, and smoked meats, or processed meats, smoked meats, and smoking tobacco. So if we're going to cut anything or reduce our intake of any particular product, you'll want to go for the type 1s. And the problem is that a lot of people really enjoy their alcohol and they really enjoy their smoked meats, processed meats, things like bacon, sausage, deli meats. I don't have a number specifically for processed meats. I've seen trying to keep it under 3 ounces per day at most. For alcohol, it's 1 drink per day for women, 1 drink per day for men. But in general, these are the things you really want to cut back on. Other things to consider cutting back on are type 2A, high temperature frying. So any, deep fried things or really high, regardless of if it's at home or at a restaurant. Red meat. So this is beef and pork and lamb. Those are things to consider cutting back on to reduce your risk for cancer. And then, of course, shift work or not getting enough sleep can also increase the risk for cancer. Again, there's limited evidence in humans for these specific products, but we do have sufficient evidence in animals. It's something to be cautious about. And then type 2B. Recently, aspartame has made headlines as the World Health Organization has classified aspartame as carcinogenic, or it causes cancer. But if you look into the groups a little bit further into detail, you'll find that aspartame is found under group 2B, where we find limited evidence in humans and less than sufficient evidence in animals. So there's really not enough evidence to say that it truly causes cancer right yet. And aspartame is in a lot of diet products, right? So Diet Coke, Diet Pepsi is often high in aspartame. But you also want to look at the dose here. So aspartame, the dose that you would need to even get close to carcinogenic would be 15 cans of Diet Coke a day. 15. Most of my Diet Coke drinkers that I work with are, maybe having it as a diet soda at dinner just to mix things up. Water gets boring over the course of the day kind of thing. If you're having 15 Diet Cokes a day, maybe something to consider cutting back on, but it does come down to that dose, right? And things that are not considered carcinogenic in humans include tea and coffee, which is great news for my first responders who really love their coffees. Now, what are some things that we can incorporate in our diet to reduce our risk of cancer as a first responder? Specifically antioxidants, and this has to come through food. Supplementation of antioxidants, things like vitamin A, vitamin C, vitamin E, selenium, curcumin, has been linked to increased risk of cancer in some cases or no effect at all. For example, there was a study of several long-term smokers who supplemented with beta carotene. So thinking that beta carotene would help clean up some of that, reduce the risk of lung cancer. However, they found that smokers who took beta carotene as a supplement had a higher risk for lung cancer. So it's not always, the way to go. We really want to get this stuff through food. Now, why are antioxidants so important? Well, they help mitigate free radical damage. And free radicals are things that you are exposed to on a daily basis as a first responder or just as a human in general. Technically, exercise can increase your production of free radicals. Lack of sleep increases production. Exposure to smoke, exposure to pollutants increases the body's production or exposure to free radicals. And free radicals are concerning because they are missing a little electron. And when they're missing an electron, they're unstable and uncomfortable. So they're going to try and steal an electron from a healthy atom in healthy tissue. And long term, this can cause damage, right? Or just feeling like crap, basically. And what antioxidants will do is give that free radical an additional electron to neutralize it without causing damage to the healthy tissue. So the more you can get antioxidants through food, fruits and veggies, plant-based foods in general, so whole grains, beans and legumes, even seafood has specific antioxidants like astaxanthin in salmon, lobster, and crab. These things can really help prevent not only cancer, but also they can help improve memory. We see a reduction in cardiovascular disease, and then we also see reduced soreness, just overall improved quality of life. So if you are going to focus on anything leaving this presentation, it would be to add more plants into your diet, more fruits and veggies as much as you can. Canned, frozen, or fresh are perfectly fine. In fact, frozen might actually have more antioxidants or a higher nutrient quality because they're frozen at peak freshness instead of sitting in the back of a truck, sitting in the back of the store, sitting in the store, and then getting to your fridge where you're too tired after your first shift of the tour to actually use the fresh fruits, and then it goes bad. So fresh, frozen, or canned, get more of your fruits and veggies in. Now, the thing that we want to cut back on, and we have a whole presentation on alcohol, but alcohol and cancer, there's a very specific link, especially with higher intakes. And the thing that I want you to understand is that higher intakes can happen pretty quickly in first responders. Drinking socially is a big thing with first responders, and those numbers can add up pretty quickly. And the concern is that alcohol is a known carcinogen, a type 1 carcinogen. It's known to cause cancer in humans. And even if you cut back or stop alcohol, you get sober or whatever, for whatever reason, the cancer risk still may not go down to never drinkers, especially if you consider people who don't drink alcohol due to religion. And the concern for cancer and alcohol is that we see higher risks for mouth, throat, esophageal, breast, liver, and colon and rectal cancers when you do a higher or a heavy intake on a regular basis. Now, a light intake or a safe intake is usually 1 drink per day, regardless of male or female. Moderate, it's 2 drinks per day. Heavy is considered 3.5 drinks per day. And of course, if you're a first responder and you're like, hey, Megan, I work shift work, I'm missing some of these days. Let's talk about it in weeks or drinks per week. Heavy drinking is still considered over 7 drinks per week for women and over 14 drinks per week for men. And keep in mind, a single serving of alcohol is 12 ounces of beer, 1.5 ounces of liquor or whiskey or bourbon, and 5 ounces of wine. And I know for me, if I pour wine into a standard wine glass, that's at least 2 to 3 servings. So that can add up a lot faster than a lot of people think. You actually have to measure out that alcohol to hit these numbers. Now, most people, even if they're moderate heavy drinkers, they might not have a problem. But as you get up to like the 5 or 6 drinks a day, that's where we start to consider it abuse and consider working with a mental health provider. Really, the thing with alcohol, though, is just to pull back gradually. And if you do need help from a therapy standpoint, you can certainly work with a therapist. Working with a dietitian can also help with that for dietary strategies. But in general, we're trying to cut back on both alcohol and processed meats because, again, they are considered or associated with carcinogen or cancer in humans. Keep in mind that decon is essential, especially after fires and specific calls, but so is diet. Diet can help reduce your risk and also just make you feel better in general. Eating more plants not only can help prevent cancer and cardiovascular disease in firefighters, but it also tends to lead to better body composition. So body fat loss, which is the number reason why most people come to the dietitian in the first place. So one other thing that I do want to mention here is that I highly recommend joining the National Firefighter Cancer Registry. This QR code will get you there. You can also go to nfr.cdc.gov, where they're just polling firefighters to see what types of cancers they have had or currently have, just so that they can continue to do more research in our first responders. So please fill this out, regardless of if you've had cancer or not, just so that we can get more research in our first responders to hopefully catch things earlier and prevent long-term disabilities from cancer. If you have any questions, my name is Megan. Megan at RescueRD.com is where you can ask me some questions. You can follow me at RescueRD on Instagram, TikTok, and Facebook, and I'll see you next time.